Those are the changes that we expect to have the most impact. Now we'll hear from Todd, from the perspective of a pipeline operator, on the impact of those changes and considerations for implementing them.
Thanks, Tom. The expanded scope here for operators is going to be pretty significant. One of the biggest changes is recognizing new covered tasks. We're going to have to look at our programs and make sure that we have covered tasks for new construction, the O&M activities, additional covered tasks for emergency response that we expect some other entity to perform on our behalf during an emergency, and also integrity management programs. Another piece is we have to identify, train, and qualify individuals performing those tasks. So a lot of programs didn't include extensive training for that, just in certain cases as the current rule is written. So now we're going to have to identify additional training. And in addition to that is also training, or at least acknowledgement of our policies and procedures. Also in the evaluations now, we're going to have to make sure that we include the technical skills to be able to perform those. So we have to make sure they have the ability to perform those activities. And then also we have to go through and look at each individual task and determine the difficulty, complexity, and importance of that task to determine the span of control limitations. And based off of what was discussed in June in Washington, D.C., we suspect that's going to be even tightened more and won't allow so much flexibility for having unqualified personnel performing covered tasks. The new training requirements, like I mentioned before, are really going to bring in a lot into our qualification process. So we're going to have to look at how we're doing that, whether or not we use a computer-based training like it's offered by Veriforce or something similar there that's used there. Also, we're going to have to look at the AOCs. How is that training being conducted, and are we properly covering both generic and task-specific AOCs during the training and evaluation? And also, we're going to have to address whether or not there's any variations in equipment and/or environmental conditions when we're doing that. If a person's qualified here in Texas, does that mean he can now be qualified in North Dakota? There may be environmental conditions that would not allow that to happen. We're going to need to review or do a program effectiveness. This is a big piece here on how we'll have to go out there and actually review our programs to see how effective they are there. It's not going to just be a headquarters in the office type review. We're actually going to have personnel in the field looking at to see how evaluators are performing their job, how a covered task being performed. And if there's ever any accident or incident on a pipeline, then we also have to go and look at ROQ programs to see how that may be affected based off of those reviews. And also the big piece on this is it's something that's going to be used by PHMSA and the state agencies as an auditing point. They're going to ask to see these records. For the new evaluator requirements, as Jessica mentioned, we're going to have to enhance those. Programs such as Veriforce have a very robust program of who can be an evaluator, what type of criteria they have to meet to do that, and what kind of training they have to go through. But internally, we have, as operators, sometimes have not done that good of a job based off of, okay, a person's been in a position for 10 years, now he's an evaluator for everything. I don't think that will no longer be acceptable for that. So we're going to have to enhance those programs. And then the last piece is greater attention to management of change. Operators, we have robust programs internally for doing this, but now we've got to make sure that we're including anyone that is performing a covered task. If there's any type of change to a procedure or how the task is being performed, now we're going to have to make sure that's communicated to all qualified personnel, field personnel, contractors, and supervisors out there that may be involved. And then there's additional record-keeping requirements. Like Jessica mentioned earlier, we have evaluator records, so the training, that selection criteria, we're really going to have to document that. We may have to actually keep a list of AOCs as spelled out currently in the NPRM. The span of control for each covered task, as you mentioned earlier, Tom, and also any agency notification. So if there's any significant changes to our programs, we've got to ensure that we're communicating that to PHMSA and the applicable state agencies.